Hi, I'm Dr. Sripathi Kethu. I'm a board-certified gastroenterologist with the Digestive Health Associates of Texas. I practice in Richardson, Texas. I've been a gastroenterologist for the past 17 years, and out of which 13 years in Richardson right here. The reason I became a physician was, it was very easy decision because my dad was a physician, so that decision was easy. And also I'm very passionate about medicine because there are very few professions where you can save lives, you can improve the quality of life, and improve their suffering all in one. And there are very few professions that can do that. That will give us immense satisfaction. The reason I became a gastroenterologist after I finished my medical school is because this is one of the most complex systems in the body, because you're dealing with so many different organs. You're dealing with the entire digestive system that includes esophagus, stomach, small intestine, large intestine, also liver, pancreas, gallbladder. So because there are so many organs involved, that makes it both interesting and challenging. When we see a patient with any digestive issues, it could be any one of these organs that could be wrong. So just thinking through that process of elimination, coming up with the diagnosis is what makes it very challenging. The other aspect I like about gastroenterology is because it involves a lot of procedures. I like doing procedures because it also challenges my technical abilities. I do all kinds of gastroenterology procedures. It could be as simple as doing an endoscopy or screening colonoscopy, although it's simple, but it's very important procedure. Everybody should have it when they're 50, but also more complex procedure. If somebody is bleeding out, if they need emergency endoscopy, or if they need ERCP procedure, that's an endoscopic procedure where we put stents if there is blockage from cancer. So because it involves so many different procedures and so many different organs, that keeps me up all the time with my academics and reading up on it, all that. So that's why I chose gastroenterology. After I finished my medical school and residency, I went to Brown University where I did my fellowship in gastroenterology. And after that, I worked in academics. I worked as an assistant professor at Brown University, where I did research, teaching, and also clinical responsibility of seeing patients. So I gained a lot of experience working there. And after that, I moved to Richardson, Texas. When you see me in the office, I want you to be very comfortable. We have great staff, and they will make you very comfortable because you may have an issue that is very sensitive to talk about. So the first thing we do is to make you very comfortable. When I see any of my patients, first thing is I ask open-ended question. I ask them, what can I do for you? So that, I can listen to the patient rather than asking a lot of questions. I think listening to the patient will help me understand the patient, not just the problem of the patient, but the patient as a whole. Because I want to take a more holistic approach where we are not only addressing the physical problem, but also looking at their psychological, emotional, or social aspects of their problem, and also lifestyle. So you get a lot of information. That way we can come up with a treatment plan rather than just using some medication to treat that physical illness, because we need to treat the patient as a whole. That may involve doing a procedure, that may involve taking medications, but I'm big on diet and lifestyle modification. I'm big on using probiotics or supplements. In my free time, I like to spend time with my family, my wife and children. I like to watch movies. I like to travel a lot. I read a lot. Most of all, I love long distance running and cycling. I've done MS 150 Hotter Than Hell races, and I've done several marathons. One thing that not many people know about me is I've run a full marathon on every continent, all the 7 continents, including Antarctica. Again, I'm Dr. Sripathi Kethu. I'm with the Digestive Health Associates of Texas. Please call us if you have any digestive issues. Please call us. We can help you. Thank you.